So this year I was invited by Insight to talk in a symposium where the topic was how can we treat patients with relapsed diffuse large B-cell lymphoma in the case the patient is not eligible for CAR T cells. And so I presented the data concerning the combination Tafasitamab with lenalidomide. So this is mainly the results of the L-MIND trial, but also some data concerning real-life outcome with this combination. So this is US data. And basically the main message is we know that the patients in the L-MIND trial are selected. Half of the patients received Tafasitamab-lenalidomide in a second-line setting and were not refractory patients, not patients with double hit or triple hit large B-cell lymphoma. And the vast majority of patients was not primary refractory to R-CHOP. So in this context, the results with Tafalen are quite good, with about 40% of patients achieving complete remission. What we see is also that these responses are durable in time for patients that achieve complete remission either in second or third line setting. In the vast majority of cases, these complete remissions are durable. But what we learned about the real life data is that the patients that are treated in the real world, at least in the US, are more advanced patients. Only 11% of them are eligible for the L-MIND study. And so in this context, with more heavily pretreated diffuse large B-cell lymphoma, we see that the Tafasitamab combination does not yield good results, with less than 20% of patients achieving complete remission. In our personal experience in my institution, where we treated patients in second and third line setting, we have around 36% of complete remission rates. And for 10 patients that received the treatment in the second line setting, half of them achieved complete remission. So the conclusion of all that was to try to define the good profile of patients for Tafalen treatment. And at least for us in our institution, is patients with diffuse large B-cell lymphoma in the second line setting, not eligible for CAR T, of course, and that are not primary refractory to R-CHOP.